So I'd like to welcome you all again to the next installment of our series, The Power of Pivoting, Managing Through Crisis, the HSS Response to the COVID-19 Pandemic. I'm Dr. Ronald McKenzie. I'm an internist and rheumatologist at the Hospital for Special Surgery, and I serve as the moderator for this series. So today we're going to talk about wellness and the culture of wellness at special surgery. We've asked Christine Goodbody, one of our fifth-year orthopedic residents, to engage in a discussion concerning this. She is a very interesting young woman. I was going to ask her what the nidus was for her concentration and interest in wellness until I read her CV and learned about her work with young women, both here and in Tanzania, and a foundation called Nurturing Minds in Africa, her interest in minority students, the homeless, participation in our bioethics committee, even a long-time interest in animal rescue. So, and that says nothing about orthopedics, frankly. So, relevant though to the discussion today, Chrissy, is your participation in the HSS Wellness Task Force. So perhaps you can tell us a little bit about your work with that group and your just interest in wellness in general.
Yeah, well, thank you for having me today. So the HSS Wellness Task Force, if you believe it, actually preceded the pandemic. So we did have some institutional structure in place already to deal with such a thing, and that was directed around physician wellness and the idea that physicians, while many admirable qualities about them lead us to succeed in what we do, sometimes they can also work against us. So a quality like selflessness we think of as extremely admirable in a physician, but at times, it's that cliche of if you don't put your own mask on first, you can't save anybody else on the plane because you're going to be passed out on the floor. So the idea that physicians need to take care of themselves as well. So that was something that we were alerted to well before this started, and I think gave us some of the groundwork for taking off from that point.
So, you tend to think of orthopedists particularly as being sort of tough customers and maybe armored somewhat against these kinds of pressures and responses, let's say, to the stresses of their existence. So do you think that's not entirely so?
I definitely don't think that's entirely so. I think I've always broken the mold a little bit on that, in that I have always been a little bit more interested in the sort of more emotional and interpersonal side of being a physician as well as being a mechanic of the body. But I think a lot of people do, and I think part of what this culture of wellness is about is just breaking the stigma of wellness, and that it is something that everybody needs, whether you are a psychiatrist or a neurosurgeon. It's something that we all need to thrive, and I think just by having this conversation, it kind of does the work of wellness itself, just by saying this is an okay thing to talk about and to acknowledge that it's something that's essential for all of us to thrive in our jobs.
So can you expand a little bit on what wellness means and what the concept subsumes? I mean, presumably there's physical aspects to it, there's psychological or mental aspects to it, perhaps there's even spiritual aspects to it. So what are your notions about that?
So I think it's both physical and emotional and spiritual for many people. Being able to do your job successfully and happily and feeling refreshed at the end of the day rather than depleted. And I think that comes a lot of ways for a lot of people. I think emotionally at work, especially at a time like this, it can be particularly stressful because we're being asked to do things that are outside of our wheelhouse. We, especially as residents, at this program are sort of used to excelling in everything we do and being able to be prepared for it. We've studied our whole lives to get where we are, and now we're being asked to do things that we weren't prepared for. And it can make you feel out of your depth and incompetent, and you start to lose the joy in what you're doing. And I think wellness is reinstating those things regardless of what you're doing, because I think it's a little bit more about your disposition than the details on what you're doing from day to day, and making sure that everybody is kind of in the same boat and on the same team and nobody feels stranded alone on an island, so that we're all kind of rowing in the same direction.
So are there methodologies that are employed to achieve a state of wellness, whether it, for instance, might be exercise, it might be meditation, for instance, perhaps it's just talking to trusted people, family, other colleagues, and so on?
Yeah, I think it's all of those things. I think a culture of wellness starts from an institutional level by instating things like peer support and talking to each other, and having a culture where it's open and okay to admit that you're struggling. But I also think it's having a culture that gives you time and encourages exercise and eating well, and again, that concept of putting your own mask on first so that you can continue to serve others the way you want to.
And have you found that those concepts have been promoted here?
I definitely think so. I think HSS does an excellent job of showing, especially at a time like this, how much we value our employees and what they do, with all of the rebranding and the daily conferences, and there's a lot of positivity and encouragement. And I think for a lot of people, reframing what we're doing in a positive light as we're really helping people is extremely helpful. But that said, I think while I tend towards a very positive and enthusiastic disposition at work, I think it can be isolating for people who are struggling. So I think at the same time, acknowledging that this is a stressful time and not everybody might feel so bright and bubbly about going in every day, and that's an okay response also, and that's also normal, and a lot of people feel that way. And making it okay to talk about that to each other, I think, is also extremely important.
So have the residents as a group been taking steps to promote that within that peer group?
We have actually broken into, a few of the residents did the peer support training, which we can talk about, but we divided up the residency into small groups that we've held sessions with over Zoom virtually, just to talk about our experiences. And I think doing so helps reinforce that nobody has the correct response to this, and that everything we're experiencing is a normal response to an abnormal situation. And whether it is to feel scared or stressed or wanting to, dive into the fire, those are all within the realm of normal, and nobody's alone in it. And I think just taking the isolation out of it and making people realize that you are not a worse doctor or a worse person by feeling one way or the other. There are lots of people that you respect and admire who have those same feelings and those same anxieties, I think can really go a long way in making people feel better about what they're doing and feel better about being in this situation together.
Okay. So you mentioned then this course that you had taken earlier in the year to impart concepts of wellness to the participants in it. Can you tell us about the content of that course, who took it with you, what you felt the benefits were of it to you?
Yeah, so we took a 4-hour course. Many HSS staff members were involved, including people higher up in the residency program administration, as well as some of the residents themselves. And it was 4 hours on a Saturday morning over Zoom. And it was mostly about how to institute peer support at your institutions and how to be a good peer supporter. And most of that are skills that we already have, but in times of stress, we might lose focus on them. Skills that we have for coping and for being a good friend and a good peer and a good coworker, like listening non-judgmentally, reassuring people, reframing their experiences in a positive way, and reminding them of what their positive coping mechanisms are. People know what makes them feel happy and feel whole, but in times of extreme stress or change, they can lose focus on that and forget what those things are, and putting them back in touch with whatever it might be, meditation, exercise, eating healthy, talking to their families, can make a world of difference for somebody. So it was a lot of practical skills for how to reach out and help people who might be struggling, how to identify those people, and acknowledging that sometimes people struggle really severely during times like this, and it is out of our depth, and how to get those people help that they need. And then one of the things that really hit home for me is following up with those people after, not having a one-off conversation with them and then making them feel like it was just like a passing conversation, but really checking in on them and letting them know that they're cared for and that they still have you open and approachable to speak to anytime. And I think just having someone to talk to makes more of a difference for people than we know.
So, and the stimulus for that program, that came from where?
That's actually a good question, and I don't exactly know the answer. I was reached out to by, I think it was Laura Robbins, but I believe the residents were nominated by their peers. I think I was nominated by one of my co-residents to do it, but I think it came from the top, which is honestly extremely encouraging that they want to promote that sort of culture of wellness from, you know, both the top down and from the bottom up, because they encouraged it on an institutional level. And then when we wanted to break out into small groups and have our Zoom meetings and reach out to all the residents, they were extremely supportive of that as well.
And as you mentioned, several faculty participated in it. And did it have, for you, any sort of lasting impact, do you think? Did it change, for instance, your coping skills with the stresses that you've confronted over the last 6 weeks?
Again, I went into it being like, I'm an empathetic person, I'm a good person, I'm open to talking to people, but I think it made those skills more concrete. And realizing that somebody who's struggling, it doesn't, you might need to reach out to them, and you might need to actually say the words, are you okay? Do you want to talk? Like, how is it going? Or trying multiple venues of how to speak with them, and sharing your experience and showing that you're vulnerable as well. And so I think it gave more concrete skills as to how to really help somebody else open up about their experiences, and show the value in how being open and honest about your experiences can make a difference to other people.
And there were instances then in the last 6 weeks that you utilized it, that you reached out to people?
Yeah, absolutely. And I think it comes in small ways, just reaching out to coworkers, asking them what happened that day, and did anything particularly happy happen, or anything sad, anything that struck them, and just starting a dialogue that makes it obvious that it's okay to talk about our feelings at work. I think that's sort of the beginning of emotional wellness at work, and I think it does go to prove that everybody I interact with is an orthopedic surgeon for the most part, and that we're not stoic and cold all the time, that these are people who are having real experiences to what they're seeing. And it's things that we didn't expect to experience during residency, and it can be really shocking and emotionally distressing. And honestly, I'm, if anything, just extremely impressed by everybody's resilience. And I think they've supported me in many ways by letting me open up about some of the experiences that we've had.
So, as an extension of, let's say, your capacities to interact with people, you've commented about that with respect to colleagues. What about with respect to patients? Did you find that it had any impact on that?
So that's a little bit hard to say, because I've been stationed in the ICU for the duration. So unfortunately, all of the patients that I have had have been sedated and intubated for the most part. So we haven't had a ton of patient interaction in that time. But I do think just reframing how we're seeing emotional wellness at this time just makes you more empathetic towards what they are going through, but what their families are going through and the people in their lives are going through.
Well, Chrissy, thank you very much for this opportunity to talk to you. It's no surprise that you might have been chosen for this program, both from your background and your nature as an individual. So good luck to you in the future.
Thank you for having me.
Sure.